evening. Good to have you with us in this edition of the Urban Debate. Over the next 1 hour, viewers, we're going to put light on the rising cases of coronavirus across the country. Now, if you see the kind of crowds that gathered during the festival season, if you see the way people flouted norms from politicians and top leaders all the way down to the common man, forgot their mask, forgot social distancing, and if you see the kind of warnings that experts had issued as we got into this season, one can only say this had to happen. But what one needs to ask is just how bad can it really get? So over the next 1 hour, we're going to give you some statistics. We'll bring in experts and cover every aspect of it. Let's begin by some simple numbers to give you a sense of how it's become so bad and could get worse. For Delhi, for example, I want to highlight the mortality rate, or actually the number of people who've died of COVID just in the last 10 odd days. Now, this data is worse than what we saw through the summer, even at that time when COVID was peaking in the national capital. We hadn't seen so many deaths. On November 13, there were 91 deaths. By November 17, we had seen 99 people die. On November 18, just a few days after Diwali, 131 people died because of COVID. And that number went up to 121, the highest ever that was recorded yesterday. If you look at the rising cases in some of the other states, Gujarat, for example, the state where many cities now have night curfew, where Ahmedabad actually went into a weekend lockdown, we have seen how the numbers have risen. The short dip is because of the Diwali weekend where testing itself wasn't really happening, but you can see the rise in the number of cases. In Maharashtra, the situation is no different, albeit it's not as bad as we've seen in Maharashtra, but look at the rise. Look at the southern rise in the daily number of cases that are now being registered in Maharashtra. There are some of the other states which didn't have a problem in the first few months. For example, in Himachal Pradesh. Now, we'll ask the experts why it's happening. Is it because of increased travel, tourism, cold weather? But even in Himachal Pradesh, we're beginning to see 600, 700, 800, 900 cases being reported on a daily basis. In fact, there was one village where the entire village of 42, 43 people, all of them except one tested positive. Such is the situation there. These are states, viewers, they have not really even focused so much on creating a healthcare infrastructure because it wasn't a bigger problem earlier. And which is why this time these states could become a challenge. Rajasthan has brought in a lot of restrictions, night curfews in many cities. Madhya Pradesh has implemented night curfews in many cities. Maharashtra has imposed some new norms and SOPs for people traveling from these badly hit areas of Delhi, Gujarat, Goa. Now, here are the few questions that we will ask tonight. Is India heading for a second COVID wave? Or perhaps a fresh wave, a fresh peak, a time worse than what we've seen so far? That's effectively what we're trying to ask, technicalities aside. Is India prepared to handle this kind of a spike in COVID cases, especially the number of serious cases? Is the laxity in following rules really causing these cases to spike? And the kind of measures we've seen, the night curfews, 1 day, 2 day curfews, restrictions on markets, specific shops being shut down, tougher fines for mask and social distancing violations, travel norms, are these warnings from our governments that if we don't get our act together now, if we don't start taking the rules seriously, then there may be a possibility of a return of a lockdown. Right now, these are very basic measures, but the messaging seems to be that this is a warning of what could be there in future if things don't improve. Before I go across to our panelists, I want to go to our reporters who are joining us from two different locations. Ayushman's joining us from Delhi. Mayuresh is joining us from Mumbai as well. Ayushman, let me come to you first. Now, not only is Delhi becoming a big challenge, but otherwise across the country, there are a few areas, few states. The Supreme Court has warned about it. We understand the Prime Minister himself will be holding the meetings with these states tomorrow.
Yes, Tanvi. In fact, if you look at the neighborhood, UP has said that anybody coming from the national capital will be tested, be it flight, air or bus route, everybody will be tested. Now, apart from that, we have seen Maharashtra today issuing a notification on that as well. The Prime Minister is going to meet the 8 worst COVID affected, and in that list of names, Delhi comes first because we are right now on top of the mortality list. And if you see the overall number of mortality in last 24 hours, Tanvi, Delhi contributes more than 23% of the total number that has come if you consider the national scenario. Now, what has happened here, Tanvi, is that the MHA, which stepped to increase the number of RT-PCR, today rolled out a facility which is one of its kind. Now, at rupees 499 in the national capital, we are going to see the RT-PCR test being conducted. Within 6 hours, we'll get the result. And this initiative is going to at least add 30,000 RT-PCR, which is the gold line standard test, into the overall scenario. Now, apart from that, we are expecting in the national capital Feluda paper strip test to start, which can also give the test in a very real-time basis. Now, apart from that, Tanvi, if you see the mortality, this is worrisome because the experts currently are saying that even during winter, we have seen in previous years as well, the death number slightly increases. But what has happened in November, if you take the overall figure like you were quoting, Tanvi, in last 10 days of November, of the 5,000 deaths that has taken place in the national scenario, more than 1,000 has taken place in Delhi alone. Every fifth person who died was from Delhi. Now, this is something worrisome. We have asked the health minister as well, who said that because of the stubble burning, this increased, but that is not the fact. The fact is that somewhere the tracing is failing on ground, and that's why we have seen the house-to-house survey. At the same time, we also tried to inquire from our sources as to what is the time span of death. We found the sources told us that on 10th day, within the admission and 10th day, the death is taking place. Now, what does that actually mean? The officials are saying that somewhere people are getting tested late and the admission is getting late, and that's why the symptoms increase rapidly, and that is resulting into a death or mortality. Now, this all the health ministry sources are telling us that can be curbed in near future because the testing is to be increased and the isolation facility has been closely being tracked by the house-to-house survey. How much of that will actually change the ground situation, that remains to be seen. But for now, definitely, the center's focus, MHA's focus is on Delhi to contain the rise that we are seeing in not just in active cases, but also the new numbers and mortality, Tanvi.
Ayushman, just very quickly, because you've been there on ground for the past 10 days, bringing us, updates on what you're seeing. Have the crowds at least diminished? Have at least more people started wearing masks and maintaining the distance?
Well, Tanvi, at least mask is definitely being followed, at least in front of the camera or in front of the authorities. The social distancing norm, although that is also being challaned for rupees 2,000, that is not something that can be seen on ground. Crowds are there, but yes, mask to an extent, rupees 2,000 fine is working on ground. People are wearing it, but only for the sake of the policemen and the authorities who are issuing the challan. But for now, definitely the challenge is to maintain the crowd and social distancing and the COVID appropriate behavior in the market space, which is still not up to the mark if you compare the idealistic scenario.
Well, that would be expecting a lot, but one can only hope that gradually people get this message, and instead of trying to find ways of evading the law or going around these rules and finding loopholes in these rules, they need to start following these rules. Mayuresh, let me come to you. While Delhi may be in focus right now, especially because of the high number of deaths we are seeing, Maharashtra is also beginning to see more cases as they ramp up their testing. But let's first talk about the SOP, Mayuresh, that's now been issued. How will that work and who does it apply to?
Absolutely, Tanvi. From 25th of this month, this SOP will come into the force, and basically travelers coming from particular states like Delhi NCR, Delhi, Rajasthan, Goa, and Gujarat. Those who are coming, whether they are taking air route, rail route, or road route, they have to carry RT-PCR negative report. Suppose they are coming from the flight, then that report should be 76 hours. They should be having that report in their hand before they land, and they should undergo the COVID test. And if they are coming from the rail route, they are taking rail route, then 96 hours before they take the train. So that is a new rule which Maharashtra government has set up, because seeing the cases, the daily rise in the cases in Delhi and Ahmedabad, especially what Ayushman was telling us and giving us the exact details, Maharashtra government is somewhere worried that a lot of people every day come from Delhi and Gujarat to Mumbai, whether for the professional work, whether for the businesses. And Maharashtra right now, they don't want to take any chance to give kind of a or to give encouragement for the second wave of COVID, because in the past we have seen that Maharashtra was one of the top states which recorded the maximum number of positive cases. So we can say Maharashtra has learned from its mistake, because during the initial lockdown or during the initial COVID days at Mumbai airport or at other airports in Maharashtra, whenever the international travelers had come either from European countries or from China or from any other state, Maharashtra had done only thermal screening, and they didn't conduct RT-PCR tests, or they didn't check that thoroughly, and that's why we saw how the cases, especially in Mumbai, got surged. So this time, RT-PCR test result, and that is also a negative test result, is mandatory. If you don't have, then once you land at airport or once you get down at any station, railway station, then you have to go through the RT-PCR test. If you're coming by road, then if you don't have any report of COVID negative, then antigen test is must.
Okay, so that's the rule that's been set in. Viewers will have to keep in mind, travelers will have to keep in mind the time period for, in what time period should you have taken the test, or at least given your sample for the RT-PCR. Thanks so much, Ayushman and Mayuresh, for joining us and bringing us these reports. Let me go across to our panelists and say good evening to Professor Sudhir Krishna from the National Center for Biological Sciences. Joining us this evening, Dr. Ramanan Lakshminarayan, Affiliate Professor, Global Health at the University of Washington, joins us this evening. We've also got Dr. Abel Lawrence, Professor for Clinical Immunology and Rheumatology at SGPGIMS in Lucknow, and Dr. Shashank Joshi, Dean for the Indian College of Physicians at Lilavati Hospital and a member of the COVID-19 task force here in Maharashtra. Good evening to all of you. Now, let me first up go across to Dr. Ramanan, actually. Dr. Ramanan, I want to start with you to, also get a bigger perspective, a global perspective. What we saw in many other parts of the world, what was labeled as the second wave, is that something that India seems to be headed towards based on these numbers?
So, Tanvi, globally, cases of COVID are at record highs, and so are deaths. It's unprecedented. It's happening across a range of countries. We saw Europe seeing caseloads which are far greater than what they saw during that first wave back in March and April. We see the US doing quite badly. Mexico is experiencing a pretty bad, second, what appears to be a second wave, and India is following in that same category. Now, it's unclear why this is happening exactly at this time. I mean, unclear in the sense that we've always speculated that the coming of the cold months, the winter months, when people are more likely to be indoors and close to each other, will trigger more transmission of COVID. And this is why there's been a lot of warnings about, making sure that people didn't, mingle too much on the outside and bring COVID into their households. But that seems to have happened, and you can see that during Dussehra and Diwali, particularly, there was a lot of mingling outside in markets. Mask wearing has been not really followed that much, and we are seeing the consequence of that globally, but also in India.
Dr. Shashank Joshi, would you agree? And is this largely because of the cold temperature, and the fact that we are all out now versus what we saw in the first half, where most countries were in some or the other kind of lockdown?
But I think the other part is also that we have a lot of pollution as a challenge. So we are wintered, smogged, and polluted, and we had festive season, which involved overcrowding, poorly ventilated environment, and poorly ventilated spaces with overcrowding, without masking, without distancing, was a perfect milieu for the COVID transmission. That's exactly what happened in northern states of India, particularly Delhi, and we are also seeing a little festive spillover effect in states like Mumbai and Maharashtra also.
Yes, in fact, I want to just highlight one part, which is the mortality rate, which we are looking at currently. Delhi at 1.71. Like Ayushman was just pointing out, Delhi now actually is looking at 1/4 of the total number of deaths that the entire country is recording. And so the situation far, far worse in the national capital right now. Gujarat has always been witnessing a higher mortality rate. It still is above 2%. A lot of that, again, a problem that we've seen in the city of Ahmedabad, but Gujarat has seen a weekend lockdown. They've also now started announcing night curfews in many other cities as well. Maharashtra at 2.76%. And some of the other states are now becoming a concern. Himachal Pradesh, Haryana, Rajasthan are also now becoming a concern. Would it be correct to say then, Professor Sudhir Krishna, that this time our concern isn't just the high number of people who get infected, but the high number of people who get severely infected and who may actually end up becoming a fatality?
So my understanding from talking of clinicians, and I've talked to quite a few in the last couple of weeks, in Bangalore and Karnataka, we are not actually facing a problem right now. The curve looks fairly, things seem okay out here. So I'll leave it to the others to talk about the other areas because they probably know more. And I'll sort of keep my comments for vaccine innovation and the vaccine efficacies and those kind of issues, which I think you'll take up a little later in the program.
Okay, fair enough. In fact, since you did bring up Karnataka, as far as the Karnataka's positivity rate is concerned, in fact, that is far, far lower than several other states, so which is a good news. Even in terms of the number of deaths, it hasn't been such a big concern for Karnataka. But Maharashtra, Madhya Pradesh, Rajasthan, Gujarat, and of course the northern states where it is a colder temperature is what we're looking at. Dr. Abel Lawrence, quick comments from you as well. If this is perhaps the worst that we are seeing, or if it could get worse from here on, basis cold weather and pollution.
It is not merely cold weather. Festival season. During festival season, people travel to their native places from their place of work. So this is a time of great displacement where people travel from one city to the other, and families come together, and relatives, neighbors, they all get together. And so this is a ripe situation for transmission within the community, within the family, within close circles. And our messaging so far has been: wear mask when you go out, wear mask when you go to the market. But we have never told people to wear mask during indoor reunions. And this is something which has been a lapse, and now we are discussing this after the festival. This should have been done before that. Secondly, during these festivals, it is not sufficient that people meet. People exchange sweets, they eat something, and it is considered very impolite not to eat when you visit someone's house. This puts pressure on people. So I have talked to some of our residents who went home. They're educated, they know everything about the virus, but they find it very difficult to tell their relatives and friends not to do this. The social pressure to visit families and then eat from their houses is a major contributor, and we are only seeing the beginning, and whatever is seeded during the Diwali will have its after effects as the peak continues to rise.
Right.
And the mortality numbers we see are early because mortality lags behind the cases. So at least 2 to 3 week delay will be there in the mortality numbers. So the peak of mortality will follow the peak of the cases. So we will see continued rise in death as well.
No, so I'm wondering this, Dr. Abel Lawrence, that you are right, and the general sense is that people got out a lot more, interacted a lot more moved around, went to their hometowns and native places for festival season. But if that was true, and if that was a large factor, wouldn't we be seeing this in other parts of the country, in smaller towns? People from big metros who work there traveling back to, to their hometowns in Uttar Pradesh and Bihar, but we haven't seen a spike in many of these states.
It takes time for the case numbers to increase. Exponential growth curve means that initial part of the curve will be invisible. And in the last few doubling time, you will see it explode.
Okay, fair enough. Point well taken. Let me go across and now focus on the second aspect, which is whether India is testing enough and if we are actually testing right. And there seems to be a lot of debate about, the kind of test kits that we are using and the testing that we are doing with between the antigen test and the RT-PCR test. Delhi has begun to ramp up their RT-PCR tests. That was a very small proportion till last month. Ranadeep, in fact, from our newsroom is standing by with that data and that analysis. Ranadeep, of course, the government has admitted that they have to do a lot more of RT-PCR tests, but what do the numbers show?
Well, yes, absolutely. Multiple times the Delhi government has come forward and said that they have ramped up the testing. But are they testing right is the question that we are asking. For example, the data that we have collated and put up for you guys, it clearly shows that the RT-PCR tests as compared to antigen tests are way less in number. As you can see, even on the day when Delhi has recorded the least number of antigen tests, that is on November 15, and as you see this data of this entire week, that's the festive week that Delhi and the entire country has seen. Even on November 15, there was the peak festive time. Even on the day when the antigen tests have been recorded the least, the RT-PCR test in comparison has been low. So as you can clearly see, right from November 13 to November 19, the RT-PCR tests are way less in number as compared to the antigen tests. And then there have been multiple theories that have been put forward by the health ministry that clearly said that the antigen tests are not as reliable as the RT-PCR ones. The RT-PCR tests are, however, have managed to give more accurate data and not as the antigen tests were not as accurate always as the RT-PCR tests. So the question still remains over the fact that if Delhi is testing right.
Okay, let me take that question across to our panelists as well, and we'll also keep running, the number of tests that are being conducted in the other states. Now, I do want to highlight, thanks Rana for bringing us the numbers from Delhi, but I do want to highlight that in many other parts, we are struggling to get the breakup of how many RT-PCR tests have been done and how many antigen tests are being done. We do struggle a bit to get comprehensive numbers quite often from many states, but that's why we're only specifying one way. We do know it is a problem, but Dr. Shashank Joshi, are we still not testing enough or testing right?
We are not testing enough for sure, and we are not testing appropriate for also correctly, as you said.
Dr. Joshi, we seem to have lost that line. The feed is completely frozen. I'll come back to you as soon as we're able to fix that. But Dr. Ramanan, your view on this, in a bid to perhaps show that we're doing a larger number of tests, are governments making the mistake of doing more of antigens? When should what kind of tests be given preference?
So this is an evolving sort of a view on this sort of thing. And you might have heard me say something slightly different a couple of months back when the rapid antigen test is a much less sensitive test. And therefore, there were deep concerns that the antigen test was replacing the RT-PCR test, or a lot of people think that they don't have COVID when in fact they do have COVID, right? So that's a problem with the antigen test. Now, there's another aspect of it. The antigen test does have one advantage, which is that it's a rapid test, so you know immediately. Whereas with the RT-PCR test, you might know only after 2 or 3 days. And in that period of time, people may go on infecting other people if they didn't know that they were positive. So, both these tests make sense, I think, in a combination, in the sense that the rapid antigen test, and this was always a recommendation, by the way, the rapid antigen test should be given first. But if someone has symptoms and they're negative for the rapid antigen test, then you give them an RT-PCR test. But the advantage of having given them the rapid antigen test first is that you can isolate them immediately. Now, what we failed to do across the country was actually follow up the negative rapid antigen test with an RT-PCR. That has not really been done across, even though that was a recommendation from the government. That's number one. However, the positive part is that today the RT-PCR tests seem to be happening, the results seem to be coming back a lot faster. And that's another thing we should really aspire to, because that's the drawback of the RT-PCR. If you find out only 2 or 3 days afterwards, you would have infected enough people that it didn't really make much of a difference, isolating you after that. So I think we should follow the policy to the letter and spirit. Do the rapid antigen test for sure, but for every negative rapid antigen test, please do the RT-PCR.
Yes, and I think that is something that people must keep in mind. One, that for even if your antigen test comes negative, you must follow it up with an RT-PCR test. And for the governments to keep in mind that it doesn't matter if you give us a number of saying, oh, we did 50,000 tests or 60,000 tests, or we have the highest number of testing per 10 lakh or per million of your population. If you're not doing the right test, Dr. Abel Lawrence, initially I would understand because we didn't have enough test kits. And there was also a larger sense of trying to know how much the infection has spread. But is there a necessity to relook at the way our testing is being done right now, Dr. Lawrence?
Yes, we are not using RT-PCR adequately, and we have not upgraded our technology. In the US, there is a University of Illinois protocol for testing, doing RT-PCR on saliva samples. Saliva samples can be collected by patients themselves. Currently, the biggest bottleneck in doing RT-PCR is not just testing, it is collection of samples. The collection of samples is technically demanding and requires skill. And even the video shown in your TV, it is not being collected properly. Somebody is briefly poking and taking a sample. That's not how it is to be collected. This collection of samples from the nose is a somewhat invasive procedure. It's discomforting. It takes some time, and proper training doesn't appear to be being done. So moving to a saliva-based test, which is much simpler and self-collected, can speed up the process. It will reduce cost because self-collection requires PPE by the person collecting the sample. PPE is a major part of the sample collection cost. So ICMR has not looked at emerging technologies, and there are ways to speed up even further using new technologies to increase the number of tests that can be done in newer machines. So this is a major problem. Why now, after how many months, almost a year of the pandemic, we haven't sufficiently upgraded our technology?
Okay, that's an interesting point that you raised, and perhaps that's something that we should have another bigger conversation another day. And I feel that testing policy is something that continuously needs to be updated, and our preparation needs to be constantly changed as we find more and more as technology provides us more options in terms of testing, where the duration changes and the kind of kit really changes. Few days ago, we heard about another kind of a testing kit that is going to be introduced in the market, which would actually be a kind of an RT-PCR, but faster and much faster. And we are hoping that that also helps us figure out sooner than later of whether you have COVID or not. Dr. Shashank Joshi, though, very quickly, before I move on to the next angle, which is about the states and the steps that they're taking and the messaging there, even the RT-PCR tests come with a disclaimer about a very large percentage of faulty negatives. So are we still a little in the dark about, how many people really did contract COVID or not? How seriously do we take these numbers?
So if you take the exposure versus actually tested, there is a large gap, and which we all know. And we know RT-PCR also is an imperfect test, and 30% false negativity is extremely well known. In fact, CT scan has a false negative of 15%, so it has a better yield, but it is not very specific. So we know this for sure, but the main thing is test early, test aggressively, and isolate immediately. Unfortunately, when people develop symptoms, they don't self-isolate. Even if they are suspecting something, they should self-isolate. The chain of transmission can be broken. Otherwise, there is a geometric progression of chain of transmission. Unless and until we do that very quick and fast, really this testing becomes meaningless. Also, the rapid turnover time is very critical, and you can always follow it up with a second test, as the one of the speakers said, that if you do an antigen, it allows you to isolate ASAP, and then if it is negative, put a red alert on that person, watch him for 72 hours. If he's asymptomatic, then it is fine. But otherwise, do an RT-PCR as a follow-up. Then we will be able to contain the spread. The main thing is that the transmission chain has to be broken. And unfortunately, that's not happening. And that's why there is an exponential rise of cases. If we test early, test ASAP, get the result early, isolate immediately, we can actually mitigate a lot. And that's something which we need to do much more aggressively.
Okay, point well taken. I'm going to move on very quickly to our fourth angle, which is about the measures that are being taken. I want to tell our viewers why we're having this conversation, and this is really more about the messaging as well. For example, if you take a look, Delhi was the first one to come out and say they're going to restrict the number of people at weddings and large events. From 200, they reduced it to 50. Then UP decided to do it in nearby places like Noida and Faridabad, because they realized all the families from Delhi were now scouting for banquet halls in Noida to have their weddings so that more people could come. And of course, apart from that, in other cities and towns in Uttar Pradesh, this being the wedding season, a large number of gatherings were being planned. So UP has also now come in and restricted the number of people who will be allowed at weddings to about just 100 people. They've also said that anybody who's coming in from Delhi and traveling to Uttar Pradesh will have to be tested. So apart from the checks on the Delhi borders by road, even those who are traveling by other modes of transport will either need to have a test on them or they will be tested when they arrive in Uttar Pradesh. Rajasthan, take a look at the steps that Rajasthan has announced. Apart from night curfew in 8 districts. Now, this is a very interesting step. Penalty for not wearing mask increased to about 500 rupees. 75% employees allowed in office in limited number of districts. So they are now reducing the number of people who can go to work as well. And they've introduced door-to-door service because, again, there is a problem of tracing and testing. Not too many people seem to be even willing to come out and get themselves tested. Gujarat announced a 2-day lockdown for Ahmedabad. They've also announced night curfews in several other cities, including Vadodara, Surat, Rajkot, and a steep fine of 1,000 rupees if you don't wear a mask. And Maharashtra, like we were just telling you, has come out with new travel SOP for those who are coming in from these badly hit states into the state of Maharashtra. And maybe more and more states will begin to do that. But I want to ask our experts a question. Some of these steps, especially about 1-day lockdown or 2-day lockdown or night curfews, Dr. Ramanan, does this really help in stopping the infection, or is it more about messaging for people to have that sense that, okay, things may be getting bad?
I don't think there's much value of just having a one night or a 1-day sort of a lockdown. I think it is really the messaging, because it reminds them that COVID is still around and the government is still taking it seriously. And when they tell you to wear a mask, they really mean wear a mask. I think that the opportunities for transmission are so great, and they're not particularly, if you don't go out for one night, that's really not going to block the transmission. They'll just transmit, the next night, for instance. So I think this is much more of a communication issue. The only effective lockdowns have to last at least a couple of weeks at the minimum, preferably 3 weeks. This is why much of Europe is going into that duration of lockdown, which is 3 weeks or a month. Of course, in India, that is completely out of the question at this point, given the state of the economy and people's willingness to go under lockdown one more time. So I guess the options are limited, and hopefully the vaccine is really going to be the one that saves us at this point.
Let me ask Professor Krishna if he has a view on it. Professor Krishna, does this, help in any way if you have 1-day, 2-day lockdown or night curfews or only specific markets, hotspots which are completely shut down? Or is it for people to know that things are getting worse and tomorrow there could be a proper lockdown if we don't, pull up our socks?
Well, I'm not the expert on this area, but my sense would be to agree with the previous panelists that I think this is not going to work, and I think we should now not go in for huge big bang solutions. It's not going to work. We've done them, and the costs are too huge. I'm not even convinced completely that they work very well, but that's a separate issue. We can discuss that some other time. I don't know. Was that useful?
Dr. Shashank Joshi, would you like to comment on this?
Hello?
Yes, Dr. Joshi, would you like to comment on this as well? The way the measures that are being announced and if they're actually likely to have any impact?
I think lockdowns won't have any impact. There's data to show and evidence base generated across the world that lockdowns have not worked. Initially, maybe they were useful for preparing the healthcare infrastructure, which I think some parts of India have already done so, like Delhi, Mumbai, and many other parts of India. I think beyond that, lockdowns don't serve the purpose. What we need to do is micro containment and ensuring that all the red spot zones are very, very, tested, traced, and isolated in an appropriate way. We need to have public health measures absolutely in place so that there is no need to do lockdowns and hurt the economy.
Okay, I am going to thank at this point of time, our guest, of course, Professor Krishna will continue to be with me as we move on to the other angles. But thank you, Dr. Ramanan. Always good to have you, Dr. Abel Lawrence and Dr. Shashank Joshi. I appreciate you taking the time out. As I move on to angle number 5, and I want to talk about what some of the states have recently done. And viewers, education is one aspect which often doesn't get that much importance on. We don't speak about the kind of impact this field is seeing because of COVID. But effectively, the entire exam calendar, the entire academic calendar has gone for a toss. Now what is happening is, while everybody got a sense that for first 3 months and then another 2 months and another 2 months, schools will not open, we've effectively now reached the month of December. One by one, each city or each state is saying they're not going to open the schools for the rest of this year, maybe in January. So I feel, and this is our view here on Mirror Now, that perhaps the governments need to take a larger view and come out with a clearer direction and a clearer policy when it comes to our schools. If the teachers have to prepare, if the schools have to prepare and look at their syllabus in a certain way and plan their syllabus and teaching in a certain way, where schools don't open at all, not everybody is able to complete the syllabus via online classes, then they need to be told now. It can't be a decision that's extended for every 2 weeks, where each state or a district gets up and says, okay, another 2 weeks we won't open the schools. Oh wait, we did open the schools for a week, but now we think it's not good because the infection is spreading and we shut it down again. I think it's playing with lives of our little children, their academic future, and the fact that it will also have a psychological impact on if we continuously keep changing our policies. But let me bring in a very special guest, and Mr. Anil Swarup, who has exhaustive experience when it comes to policy making in the field of education, joins me this evening. Mr. Anil Swarup, thank you so much for being with us. Let me begin by asking you, do you believe that there is a need for overall policy? Education is usually a state decision. Right now it's been left to individual schools and districts to decide, but should there be a larger direction to this policy to not open the schools for a definitive period?
It's a difficult situation and difficult decisions to be taken. The situation varies from district to district, and hence it may not be advisable to take a decision centrally for whether the school should be open or not. It will all depend on the COVID-related situation in that particular district. If you look at the data district-wise, you'll find a large number of districts where there is no incidence of COVID. There are some districts which are badly affected. So taking a single decision for all the districts may not be appropriate. It would be best be left to the local authorities to take a call on it. But the situation is pretty bad in some of the districts, and there, of course, the schools may have to continue to be closed.
No, it is a difficult situation for sure. But I ask this question, Mr. Swarup, because do we need to then relook at the academic year, the amount of syllabus? Of course, there has been some amount of rejig there, cutting off of syllabus that's already been done. But if the schools are going to be shut for longer, for a few more months at least, then do we need to relook at all of that? And then shouldn't we have more clarity right now?
No, I don't see a major problem with up to class 8. Some sessions are going on, and I don't think heavens are going to fall if children are allowed to go to the next class and maybe a limited examination if required. So I don't think there is a major problem regarding up to class 8. a decision can be taken to close down schools for the entire year. But in classes 9, 10, and 11, 12, I think some schools have already worked out a strategy on how to maintain social distancing in 10 classes. There are various alternatives that are available that could be considered. But as I said earlier, there can't be a generalized discussion sitting here in Delhi. Situation varies from district to district, state to state, and it would be best to take a decision locally as to whether the school should open or not.
Okay, let me ask you this then, Mr. Swarup. To your mind, what has been the biggest challenge in the COVID era as far as education sector and the education policy is concerned?
You know, education does not merely relate to teaching per se. It is also social association, a lot of activities that are involved in it. And I think the biggest challenge has been that there is no physical interface between children and between children and teachers. Of course, a number of schools have resorted to educating through internet. That's the second best possibility. Of course, it can never replace a physical interaction with the teacher and with their friends, because it's not merely education that happens in a school. You get social interaction with your friends, you evolve as an individual. I think that is the biggest problem. Education, I think children will catch up. Even if there is a loss of a year, they will catch up next year. But I think this, as they grow as youngsters, their association and interaction with other children and teachers is very, very important, and you can't help it. They have missed it out.
Yes, and what's also a little concerning is that next year too, Mr. Swarup, the situation may not be widely different. COVID isn't going away. We don't know when we will be able to, have a vaccine and get it distributed to everybody. And if you're talking about reopening the schools, a similar challenge may come across. Do you believe that children need to be a priority group for vaccination, something the government needs to look at right away?
I think children will always be priority group. I think the biggest priority, of course, will be those above the age of 65. That's the most vulnerable lot to COVID. But then, of course, children would be an important group to be attended to as and when the vaccine comes. It's very difficult to visualize as to what's going to happen hereafter. One will have to be prepared. The government will have to be prepared for all the eventualities, because as we see in other parts of the world, after the flattening of the curve, it again goes up. You never know what's going to happen next. I think the real problem that I see in our country is that in a large number of places, and I don't think government can be blamed for everything, the ease with which some of people are floating around without masks and they are coming together and gathering in various religious and other festivals, it's a bit shocking. It's very difficult for the government to hold that, because there are variety of sentiments. I think people will have to be somehow informed through various social groups, including the government, to follow certain discipline. And unfortunately, that discipline was not visible when the elections happened in Bihar. We don't see that discipline happening when the festivities are on. It's very surprising, and I think we will suffer on account of that.
Well, we are suffering on account of that, Mr. Swarup. That was essentially our conversation before you joined us. And, you're completely right. And sometimes it scares me and it amazes me the way we are all behaving, where we have absolutely no concern for COVID at all. And we don't follow the norms. For children, though, Mr. Swarup, it's an even bigger challenge. When they're at home, it's okay. But when they start stepping out, when they start going to school, to force them to follow these norms, maintain hygiene, to wear a mask, will that become a problem for schools and authorities in terms of ensuring that they follow these rules?
I have been in touch with a number of schools in various capacities, and that's why I suggested up to class 8, I think I don't see schools opening. They shouldn't be opening. Class 9 to 12, I can tell you, children of that age would be much more disciplined that we see on television screens these days, whether it's election or otherwise. And so schools are a place where discipline can probably be enforced much better. So I'm not totally lost on that. I'm still hopeful. As some schools have come up, some schools are working on alternative day opening so that they can maintain social distances. And once the number of children comes down, that is if they have schools only for class 9 to 12, the overall number of children in the school will be much lesser. And if teachers are there, discipline can be maintained. It's not that it can't be maintained. It would certainly be much, much better than what happened in elections in Bihar or what happens in the festivities that we have when we see it on the television. So I'm not totally against opening of schools, but in places where they are able to maintain social distances and for classes 9 to 12, because at that level, I think losing out on a year will be very, very tough to recover.
Okay, great to have you on the show with your views and thoughts on, the policy when it comes to reopening schools and colleges and the future for the academic session as well. Thank you, Mr. Swarup, for joining us here on Mirror Now.
So, thank you.
Well, let's move on to the final talking point and big conversation point. Everybody's talking about it right now, the race for a vaccine, the hunt for a vaccine. And I have Anu Bhuyan, special correspondent for India Spend, joining me right now. Of course, Professor Sudhir Krishna continues to stay with us. Professor Krishna, to begin with, what we saw is an announcement from AstraZeneca and then Serum Institute today was a little interesting. And we are only learning as we go along as far as vaccines are concerned. But they gave us details of efficacy of 2 different doses which were given a month apart. And the percentage of efficacy was different. And then AstraZeneca said that we're looking at a 70% efficacy for this vaccine itself. Now, what does that mean? How does that interpret?
Right. So I'll follow pretty much what I've said before on your channels. And I'll run through some of the key points and then we can follow them further. One is, I don't think it's a good idea to have only one vaccine for a number of reasons. For example, if you impose we'll come to cost, manufacturing, vaccine design, and so on. But if you impose selection pressure with one vaccine and it doesn't do very well, you're not in a good situation at all, right? Because the viruses will evolve, they'll respond. I mean, flu is obviously the most famous example of selection pressures when you have vaccines. So I think it's not a good idea to have only one vaccine per se. And I've said this many times before. With the adenovirus recombinants, my concern has always been that when you have a big backbone, then you're actually immunizing to the backbone as much as you're immunizing to the spike protein. It's very interesting that the low dose versus the high dose, 90% efficacy that they're getting with 2 immunizations. That's a very interesting outcome that's emerging. My concern with the adenovirus recombinants has always been, how do you ever use them again? Because any memory will be largely to the adenovirus recombinant, right? In the specific context of India, we don't actually know what is the serological response to adenovirus recombinants. I think one of the papers that I was reading was that in the UK, they have 0 seronegativity to the adenovirus recombinant. In Gambia, where they looked at it, there was about 9%. We have no idea in India what the backbone seropositivity is to the recombinants. Remember that the infection has played out very differently in India, whether it's the coronavirus, other coronaviruses, serology, cross-reactivity, or whether what's it going to be with adenoviruses, we don't know. So those are the cautionary comments on that. I'm not knocking it at all. In terms of vaccine innovations, and a vaccine like Bharat Biotech, which uses a classic inactivated vaccine, I think that's a pretty safe vaccine. I mean, the other proteins that you're immunizing against are not the spike proteins, but the other proteins of the virus itself. That's the classical tradition. There's no risk. They're safe. I mean, if you have reasonable efficacy, I would work with that. I will come to the innovation component with the mRNA vaccines. I believe Pune has a company which is already doing mRNA vaccines. The great advantage of mRNA vaccines is that you're focusing on a single protein. Look at something like the space race in India. When we took on the space challenge, we do it about 1/10 the cost of other countries. So I think there's a huge innovation spectrum if we focus on the cold chain issues associated with the mRNA vaccines. There's a huge innovation challenge. We should focus on that. And I think, as I said, I'm not knocking any one vaccine, but we should run with all of them. I'll come to vaccine efficacy trials a little later if we have time.
Okay, but like you said, that if we address the cold chain part of the storage and the transport for mRNA vaccines, then of course that could be a big thing. And if those are the vaccines that actually come through finally for approvals to begin with, then it could become a big challenge for us. Anu Bhuyan, good to always have you with us. Many people are asking, basis these trials and the numbers that we're getting, how seriously should we take them? The fact that they are so fast-tracked, the fact that they've just been tested on a limited number of people, and they may be from another part of the world. If you can shed some more light on that.
I was just reading a piece. I was just reading an interview with Gagandeep Kang, who is currently at CMC Vellore and infectious disease specialist herself. And she was saying that we should be cautious about these numbers because these are what she called headline numbers. These are press release numbers, and the actual data by these companies has not been submitted. It hasn't been published. These companies are yet to submit a lot of their data even to the regulators in their respective countries for approval. And let alone have they published this in journals for the larger scientific community to examine, and for clinicians, or for even people like me who may want to take the vaccine to assess myself. So the numbers do have to be treated with caution, and a lot of and I mean there are trials that are going on in India as well, but of course the scale that is happening abroad is much larger than it is happening here in India. And generally speaking, the Indian drug regulator does ask for trials, whether for drugs or vaccines, to also happen in India at a sufficient scale. But unprecedented times. The government has already made announcements several times. Everything from Bihar will be the first state to receive this vaccine, to the health minister constantly saying that by July 2021 we will vaccinate 500 million people, which is in fact India's overall annual vaccination target is about 400 million vaccine shots for children. So the government has a lot of face saving to do if this doesn't happen. So I do imagine that there's pressure on this process, and the nature of political statements does not make me feel extremely trusting towards the data and the process. To answer your question, we only have this headline data and these headline numbers, but we should make decisions based on full data. We should pressure companies, pressure regulators to come out with full data so that we can make our full informed choices.
Yes, in fact, I want to point this out. Even if you see the way the announcements are being made, not just by companies in our country or those that we have partnered with for the vaccine research and trials, but abroad as well. Now, one day they will say our interim analysis shows us 90% efficacy. Then another one will come the next day and say, oh, ours is 92% efficacy. The third one will come and say, oh, ours is 94% efficacy. And these are all interim analysis. This is not even the final for a lot of these companies which are conducting the trials and researching and on a very small set of people. Yeah. In a very short span of time. And those are the things we will have to consider, and hopefully the government will focus on these before finally giving an approval to whichever 1 or 2 or 3 vaccines we do bring in. But Anu, very quickly, even if we had to take them on face value and say within the next 2 months they will start manufacturing, or by summers we can have these many doses and millions of doses in our country, is our system to manufacture and transport and immunize really ready?
I have been looking at this subject about whether we do have adequate logistics, cold chain, to make this vaccine available to this target of 500 million people. But before that, I just want to flag to your earlier point, a report in Times of India as well as Economic Times, I think just about 2 days ago, which said that Bharat Biotech, the company that's making the vaccine in India, along with Indian Council for Medical Research, did report an adverse event in August.
Yes.
And unlike what's happened with AstraZeneca and Pfizer and J&J, when they had an adverse event, they halted their trial. There was an investigation, and and only then and a public disclosure was made. So anybody who wants to sign up as a volunteer for these trials knows this information. But in India, Bharat Biotech, this information was not made public. We have to just assume now that due diligence was done. But to your question about cold chain, I think it is going to be a challenge for India, because Indian companies make the bulk of the world's vaccines. So we have all the vaccines in the world. Whenever this COVID vaccine is ready as well, it'll all be shipped out of India. But do we have the capacity to make it available to people even within India? This is definitely a problem. We distribute about 390 million doses to children and pregnant and mothers in this country every year. That's our target, annual target. But we're also claiming to now want to distribute 500 million doses to adults. So this is, this is definitely going to be a problem. And the government, an indicator for me is how much the government is boasting about a certain thing. And the Indian government hasn't yet started boasting about cold chain. So to me, that tells me they don't yet have anything ready in place, because they're not even boasting about it.
Okay, very quickly, I am out of time, but I did want to go back to Professor Krishna on the efficacy part of it, and also Professor Krishna on how many people will actually need to be vaccinated in our country? Does the entire population need it, or only a set of them, those who've contracted COVID, will they need to be vaccinated?
So these are very good questions. And one issue that you just talked about, and let's take the last point, whether people who have contracted COVID before or are seropositive need to be vaccinated. I want to refer a little bit to what the previous panelist said. I don't think we should take phase 3 clinical data from the companies or anybody that seriously. I think we should conduct our own vaccine efficacy data. And when we start vaccinating, if you want to call it phase 4, probably the maximum learning will happen then. We'll get a sense of whether we should target specific groups. We'll get a sense of whether we can develop immune signatures before we can immunize people. We'll get a sense of what the herd immunity is like. And do remember that vaccine efficacy and vaccine effectiveness are very different things. Vaccine efficacy is done in sort of trial conditions. Everything is narrowed down. Vaccine effectiveness is actually at the level of the community. So that's the importance of actually not overplaying, either criticizing or, being too excited about these trials, but moving on to sort of actually designing, bringing in modelers, bringing in clinicians, bringing in immunologists, bringing in a range of people who can actually analyze the data as we roll it out and be cautious. As to the specific point about Bharat Biotech's disclosure, I have no view about that because I don't really have any information. But I think the important thing is to be transparent and to try and encourage our companies to meet world standards. And I think they're doing their best. I think they're doing their best under very difficult conditions.
Yeah.
And I certainly wouldn't knock them at all.
Well, I don't think that it's about the companies who are doing it, but it's about ensuring that the governments don't pressurize them enough to push forward or ignore certain data or not give us the full picture because they have to meet a deadline, and that's what we would continue to caution everybody about. But thank you so much to Professor Krishna and Anubayan for joining us. We continue to have these conversations. It's extremely important to track every step of this, search for a vaccine, hunt for a vaccine, or race for a vaccine. Depends what you want to call it. At the end of the day, many are hoping that this would actually be something that at least bring us some kind of relief. It may not come anytime soon, not even with the final approval or announcement of a vaccine that we will use, but at least it would be one step closer to getting some kind of a solution or relief. Thank you so much for joining us on this conversation.